Well, they are your local experts in orthopedics and sports medicine and rheumatology.
And when it is time to take care of that injury or pain, you want someone whose passion is getting you back to the things that you enjoy.
Today we meet OSMS Orthopedic Surgeon Dr. Parman, who draws from his own experience when treating patients.
Good morning, my name is Lauren. I'm from OSMS, and today we're joined with sports medicine fellowship trained orthopedic surgeon, Dr. Parman. Dr. Parman, thanks for joining us today.
Thank you very much for having me.
Yeah, so tell us a little bit about yourself. Who are you and why did you become an orthopedic surgeon?
Why I became an orthopedic surgeon, I would say when I was growing up, I had a lot of experiences visiting my local orthopedic surgeon and had great experiences, and these were after some major athletic injuries, and I built a great relationship with him and built trust in him, and he was able to get me back to the activities that I really enjoyed. And so I think that mixed with the anatomy classes in college and in medical school really sparked my interest in becoming an orthopedic surgeon. And now I feel really blessed being able to use that knowledge to help other patients get back to the activities that they enjoy on a day-to-day basis.
Based on the relationship that you had with your orthopedic physician, what can patients expect from you as their orthopedic physician?
Good question. Patients can expect from me to really sit down with them and listen and figure out what's going on and really provide a unique, individualized recommendation from me. Each patient has their own unique story or circumstance, and oftentimes that story or circumstance is more important than the underlying condition or the injury that's causing them pain in the first place. Having good communication, listening, and being on the same page with patients is incredibly important in forming the correct diagnosis and then coming up with an individualized treatment plan for the best scenarios moving forward.
Yeah, I think that's an excellent way to approach that. So knowing that you are sports med trained, what are some of the injuries and conditions that you see and treat?
Yeah, so as an orthopedic surgeon, I do see a wide variety of musculoskeletal injuries. However, my focus and my passion does indeed lie in sports medicine. And those injuries often involve injuries around the shoulder, such as rotator cuff tears, shoulder dislocation and instability, as well as injuries around the knee, such as meniscus tears, or other ligament injuries, such as ACL injuries. Oftentimes, injuries surrounding ligaments and tendons can be treated non-operatively, but if they do need surgery, many times they can be treated arthroscopically, which means using a small camera as well as a video screen to perform the procedure through small poke hole incisions in order to obtain a good repair while minimizing other tissue damage. It's a passion of mine, and I do really enjoy being up to date on the latest technologies available for these types of procedures in order to provide patients with a safe and effective surgery.
Yeah, that's great to know. If I do suffer an injury, whether it's from a sport or something else, how do I know when it's a good time to see an orthopedic physician?
That's a great question. Many times pain from minor injuries or aches and pains that sometimes sort of come up out of nowhere can get better with things like activity modification, rest, ice, medications. I would say a good time to come into an orthopedic surgeon and be evaluated is if your pain continues after trialing those things first. There are other times when you should come in to see an orthopedic surgeon, such as after significant injuries or major trauma, or if you're unable to move an arm or a leg because of severe pain, or if you're unable to walk at all because the pain is so severe. Those are more red flag symptoms, and it's usually best to be checked out sooner rather than later by an orthopedic surgeon.
Wonderful. Thanks again for joining us today.
Yeah, thank you for having me.
Well, OSMS has locations in Green Bay, Marinette, Neenah, and Oshkosh.
To make an appointment, give them a call, 920-430-8113, and you can also do that online and learn more about their services at osmsgb.com.